When should you get an ultrasound for testicular cancer? Have you ever wondered when it's the right time to get an ultrasound for testicular cancer? This is an important question, especially for those who may have concerns about their health. Getting an ultrasound is a key step in diagnosing testicular cancer, and knowing when to seek one can make a significant difference. You should consider getting a testicular ultrasound if you or your healthcare provider notice a lump, swelling, or any unusual change in your testicles during a self-examination or physical exam. Ultrasound is the primary imaging tool used to evaluate any abnormalities in the scrotum. It helps determine whether a lump is located inside or outside the testicle. This distinction is crucial because lumps found inside the testicle are more likely to be cancerous. If there are symptoms or physical findings that raise suspicion of testicular cancer, an ultrasound is recommended. Specific situations that warrant an ultrasound include having risk factors for testicular cancer. These risk factors can include a history of undescended testicles, previous testicular cancer, testicular atrophy, or a family history of testicular cancer. In these cases, an ultrasound may be used for ongoing monitoring or follow-up. Another situation to consider is if testicular microlithiasis is detected. This condition involves small calcium deposits in the testicle, which are often found incidentally during an ultrasound. If you have other risk factors for testicular cancer, follow-up ultrasounds may be necessary. However, if you do not have risk factors, routine monthly self-examinations are generally recommended instead of repeated ultrasounds. In cases where the initial ultrasound findings are unclear, and there is still suspicion of an issue, your healthcare provider may suggest a repeat ultrasound in 6 to 8 weeks to monitor any changes. One of the great things about ultrasound is that it is non-invasive, painless, and does not involve radiation. This makes it an ideal first step in evaluating any testicular abnormalities. It is important to note that ultrasound is not used as a routine screening tool for men without symptoms or risk factors, as testicular cancer is relatively rare. Self-examination remains the primary method for early detection. In summary, you should get an ultrasound for testicular cancer evaluation if you notice any lumps, swelling, or other symptoms in your testicles. If your healthcare provider finds abnormalities during an exam, or if you have known risk factors, an ultrasound is warranted. Regular monthly self-examinations are crucial for early detection, and ultrasound serves as the key diagnostic tool to clarify any suspicious findings. Always consult with your healthcare provider for personalized advice and guidance.